Thanks everybody. Our theme for this discussion: the significance of early prostate screening in the prevention of prostate cancer, particularly among Black men. I'm Clifton A. Castile, and I have chosen to share anecdotal information about my personal experience with prostate cancer. Now, before we start with our significant presentation, you may notice that I am frequently adjusting my overly worn eyeglasses. Well, it's like this. Last week, I visited an optical store to purchase a new pair of eyeglasses exclusively for this Paramount presentation. Consider this. After 30 minutes of assisting me with different pairs of new eyeglasses, I politely heard, "Now, sir, I recommend you keep the pair of eyeglasses you're wearing." Of course, I was going to ask for an explanation. Well, sir, it's like this. Each new pair of eyeglasses enhances your lower eye bags. What? Yeah. You see, your current eyeglasses cover your lower eye bags. Now, sir, if I were you, I would not purchase a new pair of eyeglasses only to reveal your lower eye bags. I hadn't thought about that. You know what? I'll just keep my current eyeglasses and I'll just consistently adjust them. Now, that's a good choice, sir. Lately, we have been saturated with news of men of all ages who are living with prostate cancer or who died of the disease. Mostly, they involve men who are revered as politicians, athletes, celebrities. Prostate cancer is the second most common cause of cancer death in American males, and it is the leading cause of cancer death in males over 50. Most noticeably among Black males, who are the least likely to be screened to prevent prostate cancer. You know, having cancer is just part of the aging process. Chances are each of you know someone who succumbed to prostate cancer or another type of cancer. Former President Mr. Joseph Biden has occupied the news for having stage 4 prostate cancer, which has metastasized to various organs. And you know, surgery is not an option. Well, only to remove pressure on other organs. So let's explore the facts versus alternative facts. And I'm talking about people who come up with innuendos and all of that. People with good intentions have asked, now, what was former President Mr. Joseph Biden thinking about not getting screened for prostate cancer? And some vouch, well, his doctor should have required a PSA blood screening test followed by a rectal exam if the results are inconclusive. Now, many in the news media lament, well, Mr. Biden was unaware he had prostate cancer symptoms due to his fast declining cognition. But consider this. Extensive research indicates that it is not uncommon for some men to lack symptoms associated with prostate cancer, as could be with Mr. Biden. In advanced age, individuals often succumb to natural causes before cancer becomes invasive. And medical professionals believe this scenario could apply to Mr. Biden. But while some men hesitant to get screened for possible prostate cancer and other symptoms associated with it, well, in most cases, this is due to unease with having doctor probing their rectum and the discomforts associated with the rectal exam and squeezing of the penis to remove fluid for examination. And this assumption is believed to be more pronounced with Black men. Now, most prostate cancer is treatable with 90% efficacy. That is, if the cancer has not metastasized into the lymph nodes, as with Mr. Biden. However, with early detection, surgery is certainly a successful option. Published research from the American Cancer Foundation revealed there's a 42% chance for a male to develop invasive prostate cancer. Now, during a rectal exam, the urologist examines the prostate with the finger to feel the prostate to determine if it is swollen and infected or pressing against the bladder, causing frequent urination. Now, this process lasts approximately 10 minutes and may result in discomfort and soreness. The prostate is a walnut-sized gland and is located near the bladder. It helps deliver fluids and semen containing sperm through the penis during ejaculation. Now, it's time for me to discuss my experience with prostate cancer and its impact on me. Now, out of caution, I began regular prostate screenings, including PSA tests and occasionally rectal exams, starting at the age of 48. Now we're going to go to age 60. After experiencing frequent urination and other symptoms, I visit my urologist. My PSA was unusually high, and my doctor suggested a prostate biopsy after performing a rectal exam. You see, a prostate biopsy involves inserting a rod in the rectum with sensors to view the gland using a scope. Now, prostate tissue is sampled to screen for cancer cells. Now, the procedure is about 15 minutes and is extremely painful, and medication isn't effective at all. And this is why some men prefer sedation in a hospital to have a biopsy. Well, after my biopsy, my doctor was unable to reach me for nearly 3 weeks. You see, I was not interested in hearing the results of my biopsy. Why? Well, I knew something was wrong, and I just feared it would be cancer. Finally, I visit the doctor's office. Mr. Castillo, there's a cancerous growth in the left side of your prostate. However, now the lab results indicate that the tumor has not spread to the major areas of your prostate. And in most cases, surgical intervention can effectively remove the affected part of the prostate without causing harm to the remaining tissue. Hence, you may resume your regular activities post-surgery. Now, Mr. Castillo, I will open date and we can schedule that surgery right now. Well, listen, I was incoherent for minutes before returning to reality. You know, hearing the word cancer places fear in one's mind and associates cancer with death. My mind was just all over the place. Well, finally I came back to reality and I scheduled a date for my surgery. Let me say this off the record. It is advisable to have someone with you for the results of your biopsy. I did not, and I remained in shock for a long time. Well, while awaiting surgery, the thought of having cancer consumed my thoughts. You know, I discontinued all contact with my personal and mutual relationships. I thought that if I told them about my situation, they might believe God was punishing me for something immoral, because none of my friends ever had cancer. And I was certain that God was upset with me. You see, I had vowed to God that I would increase my volunteering efforts if I was able to date a very lovely woman I wanted to. And I said, God, I want you to help me to date that beautiful woman. Well, after my dream was achieved, I did not increase my volunteering activities beyond what I was already doing. Now, at the age of 83, my thoughts remain unchanged. God punished me. Yet, I should be very grateful that I went in for early screening. Now, one of my daughters employed as a medical PA learned about my upcoming surgery by happenstance during a staff meeting with a technician who performed my biopsy. And when she visited, now Clifton, not father, not daddy, you are really crazy. I mean, you are having major surgery and not involving your family or your close friends. What's wrong with you? Are you ashamed that you have to have prostate cancer? Is that it? It's nothing to be ashamed of. I was divorced, you see. Well, she gathered some of my ex-girlfriends to offer prayers the evening before my surgery. You see, I maintained a close mutual relationships with my ex-girlfriends. Now, some were married and came with their spouses, yet I did not want to hear their prayers. I didn't need them. Well, at the hospital, just before my surgery, I tried to be jubilant, yet I was not. But I said this, folks, let's get this surgery started. Well, however, before surgery, it was noted that my blood pressure had elevated to 180/90, up from the usual point of 112/50. No doubt I was anxious, I was fearful. Well, while on the operating table and mildly sedated with little clothing, I jokingly stated, I need to cover my face for this. Nurses, I do hope you appreciate something so beautiful, because you may never see one like this again. Oh, now, you're asking me, what did they say? Did they concur with me? I don't know. I went out. Now, it is beneficial to have a positive attitude before surgery. Maybe not with this approach that I use. Well, after surgery, Mr. Castile, your surgery was successful. The cancerous part of your prostate was removed through a partial prostatectomy. Now, your remaining prostate is intact and is preserved, and the nerves that, because we spared the nerves, some people call it preserved, this means that you will be able to maintain an erection. However, because part of the prostate was removed, your ejaculations will be dry. In other words, sir, you will not be able to release semen. And this means that you will not be able to father a child. But, Mr. Castile, you will be able to enjoy sexual pleasure as you did before surgery. You know what I mean? In other words, if the nerves are preserved that comes from the prostate, you'll be able to have sexual intercourse. Even though I was 60, it left me with a psychological effect, as does with many men. And I was advised to visit for annual PSA screening and rectal exams if needed now, until the age of 75. And this is to monitor any potential recurrence of cancer cells. And I was told to avoid strenuous activities until my staples were removed, holding my stomach together. Recklessly, 4 days after undergoing major surgery, I was gardening and performing other activities such as being on my knees, cleaning my hardwood floors, climbing a ladder, and all of that. Well, my daughter was upset, and she shouted that a loose staple could cause infection. Now, often I neglected to empty my small catheter bag to collect urine, which is attached to, your lower leg. So during my outside visits, my urine would spill over on the floor, just like that. On one occasion, a young boy shouted, "Mama, mama, mama, look at that old man. He's peeing on the floor." Now, after 2 weeks, I felt good enough to return to the classroom. However, I had to wait until my semester sabbatical end. Now, I shared a few thoughts about my surgery with my students. I stated that I was a volunteer with hospice and offered my services to men who are terminally ill and bedridden, can't do anything for themselves, mostly with prostate cancer. Then here I am, students, diagnosed with prostate cancer. That's not fair. Here I am giving so much support to others. I heard this from one of my students. Mr. Castile, did you help them to pee? And what about cleaning them up after they are messed on themselves? Yes and yes. Now, Mr. Castile, that's weird stuff. No way would I put my hands on another man. No, not like that, sir. Well, my supervisor with hospice asked me to consider being a spokesperson related for early screening for prostate cancer. And by the way, so did my urologist. And I'll mention his name because he's such a wonderful person, Dr. Gooder. Well, I refused. And after 17 years of volunteering with hospice, just like that, I quit. You see, I no longer wanted anything to do with patients with cancer. To this day, I have not disclosed my cancer surgery. Well, only for this presentation, of course. Prostate cancer diagnosis and treatment can significantly impact mental health, leading to various emotional, physical, and psychological challenges, as with me. Well, I continued my mentoring with Big Brothers and Big Sisters, a chapter which I have organized in New Orleans. But you know, to this day, I do regret my decision not to be involved with hospice any longer. You see, I possibly could have made a positive impact. I never know. Well, let's end it finally. If you cannot afford the process of being screened for cancer, there are organizations who offer free prostate screening. Men, get screened. You know, having prostate cancer is a very painful way to die. This I know. Now, if this video was helpful, please subscribe for future presentations. Thank you so much.